Okay, so moving to the next antibiotic drug. This is what is known as a Nafcillin. All right, pharmacology of Nafcillin. Okay, sorry. Yes. So for this Nafcillin, see Nafcillin injection. That's to tell you that what it could be intramuscular or intravenous, right? So it's actually a beta-lactam antibiotic. It belongs to the penicillin class. It is specifically designed to combat infections caused by what? Penicillinase. That's an enzyme, no? So this penicillinase enzyme is usually caused by some Staphylococcus types. Okay, so mainly this Nafcillin is to what? Combat these guys that usually produce what? Penicillinase. So how does it do this? That's a mechanism of action. It inhibits bacterial cell wall by binding to what? Penicillin-binding proteins. That's the PBPs. Now this will now disrupt what? The peptidoglycan, which is an essential component of bacterial cell wall, leading to bacterial cell wall death, or the bacterial death, in general. Okay, the whole bacteria will die. Okay, so it is resistant to degradation by what? Staphylococcal beta-lactamase enzymes. Okay, so spectrum of activity, particularly it is against gram positive bacteria like what? The Staphylococcus aureus. So it has some limited activities against gram-negative bacteria though. Okay, so therapeutic uses using infections caused by what? Bacteria like Staphylococcus that are resisting treatment from penicillin. So you now employ what? Nafcillin to tackle these guys, right? So it also can manage bloodstream infections and also pneumonia. Okay, so pharmacokinetics is administration is what? It could be intravenous or intramuscular. Absorption, there is poor oral bioavailability, hence parenteral administration is preferred. Distribution is widely in the body tissues. Okay, there's poor penetration into the cerebrospinal fluid. Okay, unless if your meninges are inflamed. Okay, so metabolism and excretion is in the liver, excretion is in bile and feces. Okay, there's a minimal renal excretion. Okay, so I have some one or two adverse effects like allergic reactions, gastrointestinal disturbances, okay, like nausea and diarrhea. Rarely will you have hepatotoxicity coming in, right, or neurotoxicity, but there's a possibility. All right, so that's it for Nafcillin.